Hi everyone, it's 12 o'clock. We are still waiting on some people to come, so let's give them all a bit of like a 5 minute leeway. Sorry for the noise in my background. We chose a day when there's sports. Can't hate on it because I get to see the sunshine, whereas in my last office I did not see the sunshine at all. I just looked straight out onto the courtyard, but there is downfalls, which is the noise. So I apologize in advance for that, but let's give people around 5 more minutes and then we'll get started if that's okay with everybody. For those who joined us a bit later on, I was just saying that we're going to start off and kick off at 5 past 12 just to give people a bit more time to reach in. So we have around 2 more minutes, so you can go get your teas. Although I don't know how to drink tea in hot weather, but here we go. And then we'll get started soon. Okay, hi everyone. Thank you so much for attending our session on dismantling systemic inequities through and within research. That's one of our four themes as part of the Research Centre. It's our final theme, so we are on our final two kind of um, sessions for this academic year. And this time we're trying to focus on maximizing your research impact through policy. And so what we're going to do today is essentially talk you through, and we have three amazing guest speakers. So today, we're going to talk you through how they have considered policy from start to finish within their work in order to ensure that they maximize the impact of policy. And they all do work in different areas within that dismantling systemic inequities area of research. So we're going to hear about, for instance, homelessness from Nicholas, for instance, right? And so essentially, this is just to give you guys a brief excerpt of what you're going to be hearing today. We are 5 minutes late, but that's just to give people kind of the time to get here because we always say that we're going to finish meetings on time. And the most I've ever been late for a meeting was 15 minutes. And I'm just like, I hope the person's still there, but they were. So we give them 5 minutes leeway, and hopefully, if they come 15 minutes late, they only miss 10 minutes rather than 15 minutes of us talking. As always, throughout all of our kind of things, I like to put a little plug in to talk to you about the EDI Research Centre and keep you updated or get you updated in terms of what we've done so far and what we still have to do or intend to do. So essentially what we're trying to do and what we were formed in with the main aim is to kind of bring people together. I always believe that the strongest things that can be done is when we're sharing knowledge, when we're all kind of building and learning from each other's strengths. And so what we're trying to do is we're not saying that we are yeah. So just to think, my amazing program manager kind of reminded me that I meant to tell you that this meeting is being recorded. It's essentially just to have us have that legacy of the wisdom that we're sharing. So when we started off, we did not record our events because we just thought the room is buzzing. We just want to keep that buzzing there. But we've since had numerous requests to record things. So the meeting is being recorded. So if you don't want to have your face recorded, you're free to not turn on your cameras, etc. Right? Um, so essentially, as I was saying before, the EDI Advisory Board is one of these things that we brought together because we know that the University of York has a range of amazing scholars who are doing really good work within the area of EDI. But there are people who want to get started out, and there were a lot of my undergraduate students who didn't want to do a PhD because they thought PhDs were boring. But I'm like, there are amazing things that you can do with PhDs. So this is what the EDI Advisory Board was formed for. It was to give people that kind of sense of the research that they can do within the area, but also to give them people that they can go to for advice if they're struggling with, for instance, how to be inclusive in their research methods, if they're struggling with how to contact different research groups that they're interested in. Exploring. That's what the EDI Advisory Board is there for. And the information for the EDI Advisory Board can be found on our website. And one of our greatest accomplishments, we did a scoping review of where the University of York stands within the four areas of interest within the center. So the four areas of interest are dismantling systemic inequities through and within research, so the one that we're doing today. The second one is inclusive research methods and methodologies. The third one is decolonizing research. And the fourth one is pedagogical research, that's the scholarship of teaching and learning. And we kind of went around and figured out what different people had done, what were the successes, but also what were the challenges. And so within the research framework, we present all of those amazing findings for everyone if they do want to kind of have an understanding of where we're at as a university within this area, but also have some examples of some really amazing work that has been done and the challenges that we still have to overcome within these various areas. Again, that is on our website. And I must put a plug in for our EDI Research Conference, which we've since kind of toying with the name of our end of year showcase, because we are a 2-year funded project and this is our second year. So it's our final year of funds that we're still trying to get more funds because we think that it is something that we've seen successes in these various things that we're doing. But just to plug that, it would be amazing if you guys sign up to come to our EDI end of year showcase, and we'll be presenting a range of different things across our four themes, and the four themes highlighted to you on the side. So essentially, we're going to have speakers from inclusive education come and talk about what the university is doing in terms of pedagogical research and the scholarship of teaching and learning. We're going to have the Center for Mental Health and Addiction to talk about what they're doing in terms of dismantling systemic inequities using research. So those various kind of speakers we're going to have, but also as part of a center, we funded various projects and done a lot of work within each of these areas. So all of those things are things that we'll be talking to you about. Okay. Also, I am quite old. I'm older than I look. And so we try to keep updated on our social media. And so we plug it every time we come. But please note that I'm not very good at remembering that social media exists and plugging things onto social media. But please do follow us. But we also have a mailing list. If you are interested in getting added to our mailing list, then do let us know. And so we're bringing us with everybody back now to the reason that we're here to have our three amazing speakers speak to us about dismantling systemic inequities. And so just a reminder, we're going to start off with Professor Martin Jones, who is here and ready. And so he's going to talk to us a bit about his work within human rights law. Do you have slides, Martin, that you want to share? Okay, so I will stop share, and please feel free to start sharing your slides.
Okay, there you go. That should be visible to you now.
Yes, it is.
Yeah, great. So I wanted to talk to you a bit about the work that I do with my broad area of research is on refugee law and policy. And within that, I wanted to share with you an experience of a research project that I had that I think reveals some of the issues and some of the challenges that we're talking about in this session today. I'm not presenting it as the solution. It's a solution in small pieces that we stumbled towards and was rather imperfect. As I'll point out during the project, is a project that occurred also over COVID, and so that imposed a range of additional challenges on us. The background to the project, and I suppose the focus of it, is on a phenomena that hasn't been much reported on. As you're aware, refugees increasingly have to move irregularly, and often this involves very risky journeys, most notably off the shores of this country in small boats across the Channel, but across the Mediterranean and other bodies of water. In Southeast Asia, there's been a regular and large-scale movement of Rohingya refugees from their country of asylum, originally from Myanmar and now from their country of asylum in Bangladesh, down towards Malaysia. And this has often resulted in very perilous journeys in overcrowded boats that run afoul of the weather and sometimes of traffickers' kind of nefarious plans for the participants on the boats. The end result is that you have a large number of refugees being stranded offshore in the triangle of international water that's bordered by Thailand, Malaysia, and Indonesia. And over the last decade and a half, increasingly the refugees have been rescued by local Achenese fishermen. Aceh is the northernmost province in Indonesia. It has a particular, very un-Indonesian, sometimes anti-Indonesian history. And it's fishermen from these coastal communities along the northern tip of Sumatra that are bringing these refugees ashore. And the project tried to look at why and to try and unpack some of the ways in which these rescues are disregarded or marginalized as kind of important features of protection. So that's the background. I'll say a little bit more about the research context because I think unpacking systemic inequities has to begin at home, like anything else. And so I want to acknowledge some of the systemic inequities embedded within the research project, not in the place of research, which in this case is far away, but rather much closer to home. I'll say a little bit more about the research itself and kind of the ways that we try to unpack the systemic inequities in Aceh. And then I want to say something more about the impact, because I think that's one of the things that brings us together today is to talk about kind of how we imagine policy impact. And I guess I want to underscore at the start that I'm not going to be talking in a way about policy impact. I mean, what I'm going to be talking about is practical impact. And I'm going to distinguish the two and explain why we picked practical impact as opposed to policy impact when I get to that point. So I guess close to home, obviously, I'm situated in a position of privilege within a hierarchical global North institution. And the funding that we received was in this particular case was from the British Academy, but typically most of us receive funding from Global North funders. And I think we have to kind of recognize the kind of the marketized hierarchical way that kind of structures and informs the kinds of projects that we're able to pitch. Equally, I mean, my research is about refugees, so an inherently marginalized group of individuals, marginalized initially because of a risk of displacement and then subsequently by their movement to new places. But also my work is with local actors. So in this case, these local fishing communities who are marginalized both within Aceh and within the Indonesian national state more broadly. Beyond that, we talk more frequently in refugee law and policy about the international refugee regime, and we privilege the kinds of pictures that you see on your screen of humanitarians, international humanitarians rescuing a particular depiction of refugee without agency, a child in this case, under the flag of the United Nations. And that is a particular kind of privileged actor and a particularly unprivileged depiction of refugee that the project tried to kind of actively interrogate, both in its selection of partners and how we worked, and also the role that we gave refugees within the project itself. The project was in not only a country of the Global South, but a part of that country, which itself disputes whether or not it should be part of that country. So Aceh is formerly actively successionist, now just tempestuously successionist part of Indonesia with its own particular, very much national history within that newer Indonesian nation state. And so all of these are ways of kind of situating the project, but also recognizing some of the power relations that we're bringing and that are existing within the research field. I guess I should say, because this will probably get lost in the discussion of the research itself, that I think there's some ways that we can approach this reality. I was aided certainly by the fact that this research project very much was co-designed from the start with organizations and people in places with which I've had a very long attachment. I've done work for decades now in that part of the world. The people who are project partners are people that we've worked with in various other ways for a long period of time, who themselves have been engaged in the rescues and supporting fishing communities for all sorts of other reasons, not just because they support refugees, but also in response to humanitarian issues around the tsunami that a couple of decades ago, and also in relation to conservation issues. So these are projects that come out of longstanding relationships and are co-designed from the start. And within the project, we used a very distributed approach in terms of organizing ourselves. This is what I said about this being a COVID project. Initially, it had actually been a lot more centralized, and COVID, by removing any possibility of international travel or even a lot of local travel, made us really empower individual, very local teams of researchers. And really our job then was to facilitate how they networked and communicated and shared findings between each others, as opposed to us going and organizing them and supervising everything on the ground. So it turned out to be quite a decentralized approach, not in our initial proposal, but in the way it worked. And I think that was actually one of my great epiphanies and successes, or certainly one of the features of the project that I enjoyed the most. We also designed the project in a way that allowed us to spend a majority of the funds in both Indonesia, and we did work in Malaysia, because many of the refugees end up in Malaysia. They don't spend all their time in Indonesia. Indonesia and Aceh are often places of rescue and reception, but also places of transit. So the rescue, as I said, I mean, just to give you a little bit more background, were done by local fishing communities. And one of the ways that these rescues are often explained that the project sought to counter was that these projects are often explained as simply kind of cultural acts of humanitarianism. And we pushed back on this because it struck us, and this was a project, like I said, that was begun in kind of angry discussions with our local partners before it led to a funding proposal when we thought we might be able to get some support for this. Some frustration that there was a lot of really important stuff that was going on, but it was being recognized in a very dismissive kind of way. So this is wonderful that these fishermen are being generous and hospitable. That's part of their culture of generosity. But it's not really a lesson that can be used anywhere else because the situation of these refugees were somehow particularly dire. And well, it's a cultural practice, and so you can't really move those anyways. And so really the project tried to unpack a lot of the assumptions that went into that characterization in the literature more broadly, and to try and provide kind of an empirical basis that these local actors and those fishing communities could push back against them. And we found that there was kind of a legal Orientalism, for want of a better term, in operation, kind of a Western gaze by international organizations that kind of dismissed what actually were local laws in action because they didn't look a lot like the Geneva Convention or like refugee law that we would see in this country. It was, in fact, a local customary law that was in every key feature a legal system. It was being enforced by local customary institutions, in this particular case, an organization called the Pengni Malaut, which means the commanders of the sea. So a very distributed and localized customary law that existed under, in a way, the national radar and certainly beneath the international radar, and because of that was being dismissed. And the point of the research was to basically suggest that these kinds of laws and norms could be drawn upon in a range of other contexts, that this wasn't simply a cultural practice that couldn't be taken somewhere else because of the cultural specificity of it, but rather it was a legalized practice that actually, if we adopted a broader sense of what the law is supporting people in doing, could be taken elsewhere. So to get to the impact part, which is my last substantive slide, I think. So what to be done? We were in a situation, and the fishermen found themselves in a situation where increasingly the national government was pushing back against them. This became an international incident repeatedly around this time of the year. There's this, what they described locally as kind of boat season, because the winds change and it's slightly safer, marginally safer to travel from Bangladesh towards Indonesia and Malaysia at this time of year. And so at this point of the year, there typically be, and there are this year as well, dozens of boats carrying thousands of people, who many of which then get trapped offshore off of Aceh. And so this was an international issue. This became a national issue. And because of that, the institutions of the state, like the Army, or the Navy rather, and the Coast Guard, began to get engaged more and more. So we faced an increasingly hostile environment for the fishermen, and what can we do? Well, two proposals that were made locally by well-meaning local actors that we engaged with were to codify this law. This is a customary law that's developed over hundreds of years of practice. It's an oral tradition. Let's write it down so it can become visible to the state. And then the other proposal was that we bring this customary practice within both international and national frameworks for search and rescue. And so we register the Pengli Malaut and register the fishermen as search and rescue authorities. Both of these are cumbersome, legalistic processes. Both of them fit in with national and international legal regulations. We engaged with these and we supported them where we could, but we didn't make this our primary path to impact. And this is where I said kind of our focus ended up being not on policy, but on practice. The idea here is that, I mean, there's something about trying to continue this practice in these ways, in these two ways that I've described, that seems to kind of eviscerate it. This is a practice that is a customary practice, and we could talk about the legal recognition of customary practice within the Indonesian legal system, but customary practice in Indonesia means something that is done consistently by a specific group of people. And both of these proposals, in terms of codifying or in terms of registering, takes away the ownership of this practice from this group of people. It's not a dead thing, it's a living thing that's practiced every day, and the force of it comes from that practice. And both codification and registration move kind of the agency and the power of this practice and the custom itself into, I mean, frankly, the hands of organizations and parts of the state that I frankly think can't in the long term be trusted. I mean, beyond that, there's a certain irony of codifying a law that is practiced by a largely illiterate population. I mean, you are literally removing any sense of control or even knowledge of it from these communities. So instead, what we did is we, in a way, lent into this idea of it as culture. And we said, well, it's a legal practice and it should be recognized as a legal practice, but it's supported by a culture. And so we commissioned and worked with local creative professionals to develop music, songs, popular songs, dances and performances, so plays that spoke of this practice. It spoke of it as a legal requirement and embedded it within the larger kind of Achenese tradition of autonomy and perseverance and, in a sense, resistance. And we then use these cultural outputs to engage with both the public at large through kind of various Kanduri Laut festivals of the sea that are held customarily around Aceh, and also with the political elite to try and build their awareness and to give them the language to push back, at least from a local level, against some of the national political interests that were being articulated against this practice. And so my final observation, I guess, is to pick up on the words of one of our participants who asked, what need do we have for the Geneva Convention when we have the Convention of Langsa? Langsa is a small town, one of the sites of rescue in Aceh. And so, again, this goes back to this idea of trying to dismantle systemic inequities through policy. I mean, I think in this case, we had to be really careful about how we imagine policy. And so we reimagine policy as practice. And in reimagining it as practice, we continue to be able to give agency and control of that practice to the already marginalized communities. And so, yeah, that's my story. As I said, it's, I think, an imperfect example, but it's something certainly that I enjoyed participating in and learned a lot from. So thank you for giving me the chance to share it with you.
Thank you so much, Martin. That was very, very interesting. Um, I do have questions, but I'll open it up to the floor. Does anyone have any questions for Martin? All right. We'll give them some time to type if they are typing in the chat. But Martin, my first question was, what kind of, you said about you when you went in, this wasn't actually, you didn't have a clear picture of what the output was going to be in relation to this. When you were making those kind of changes or making those decisions, were the participants involved in that decision making through every single stage?
I mean, yes. I mean, partly it depends on what you mean by participant.
Sorry,
Yeah,
those impacted.
yeah. I mean, one of the things that we did from the beginning of the project is we worked with the Pengley Malaut, the Commanders of the Sea, the local fishermen's organization, to develop the project. To be honest, they first put on the table the policy outputs that I kind of dismissed. And so we did engage with those. You know, we did support them. We did help. They asked us for help with some of the drafting and whatnot. We did that. But that's not, like I said, where we probably added value. We put them in touch with both Indonesian legal scholars and also local Achenese legal scholars. And so I think ultimately those outputs were improved upon. But I think we also kind of explored this idea of agency with them, and it was really them who came up with this idea. I mean, it was a conversation around kind of how do you. I mean, so the fishermen's organization was a participant, I suppose, institutionally, but their membership is distributed in very small villages. And so the question that we struggled with was, well, how do we feed back our findings to those people? And that's where they came up with this idea. They told us about this idea of this practice of the Kanduri Laut, of these local festivals of the sea. And it's really from that, and I think it was just a coincidence of us having a conversation about how to feed back to local communities, as well as having a conversation about impact more explicitly, that kind of the two strands got brought together, and where we kind of collectively, I think, realized that that actually we should be doing the two together. That feeding back with the participants, celebrating the findings with the participants was also supporting them, and that we could do it in a more creative way.
So that's really quite interesting that like you prioritized ensuring that the policy wasn't just a policy that's written on paper in someone's shelf, but a policy that the impact of which those most impacted by that policy were, and you ensure that they were educated about that policy. Was there any kind of friction between them being told about this policy that they impacted their lives that came from a white man? I think I'm trying to phrase it in a way, but I'm hoping that you understand what I'm trying to say.
I do completely
Okay.
get it.
Okay.
I mean, to add another layer of it to the white man kind of situation, I suppose one of the things that kind of exacerbated the obviousness of my position is my complete lack of any musical dance or theatrical background. Um, I am very proud, and I tell all my colleagues at the law school that I was mistaken once for a professor of dance. But that was the proudest moment of my life. I think, I mean, to be honest, I think in some ways, because we were so heavily embedded with a local organization, so the local organization that we worked with, that I've known for a long time, um, goes back to the response to the what we call the Boxing Day tsunami. And they were very instrumental in working with local. I mean, and it was the fishing communities that were most heavily impacted. I mean, all of Aceh was decimated, but the fishing communities in particular were just decimated, both in terms of livelihood, but just in terms of people. Um, and so I think working with them, I think probably mitigated a lot of the kind of the wariness. But the other dimension to it, though, is that I think the thing that changed a little bit of the dynamic was there is this Achenese nationalism and getting, I mean, bluntly, a European to recognize Achenese identity in a way that isn't seen by the Indonesian state, I think is a moment of pride. I mean, it's depressing, but you know, if you think about kind of the colonial hierarchies in Indonesia with the history of Dutch colonialism, um, they were very happy. We managed to attract some Dutch tourists to one of the performances, and they were over the moon that the Dutch tourists were kind of to the chagrin of the Indonesian government officials who were also there, were witnessing the story about Achenese independence and nationalism. So it was, yeah, it was a very complicated dynamic, I guess, because there were layers of kind of colonialism, kind of and legacies of colonialism going on in some of the interactions. But I mean, to answer your question kind of most directly, I think that kind of any wariness about my presence was mitigated by two things. One is what I said about
The
the
organization.
organization, but the other is also because of COVID. I mean, to be honest, we were a very distant presence. So the University of York was fairly abstract until some of the later stages where travel was allowed. And so at that point in time, there was a greater awareness and commitment to the project. And so it wasn't as though I was showing up on day one and trying to lead things in a very visible kind of way. I was there at the end to participate in and to try and bring more publicity to the some of the events that we did at the end of the project.
That's really good. That's really
Yeah.
good to know. Do you ever feel like this is my and I'm dominating the questions and I'm so sorry, but this will be my last question. Unless anyone else has a question. Okay. Do you ever feel like ensuring or prioritizing the individuals themselves over and above like the government organizations itself? Do you ever worry that that is not giving you the amount of outputs as a researcher as you would get if you focused on the organization itself?
Um, I mean, we had we deliberately recruited a really diverse research team.
Mm-hmm.
So in the Malaysia branch of the project, our researchers were predominantly refugees. In Indonesia and Aceh, they were either early career researchers in Indonesia or, like I said before, very local
Yeah.
embedded individuals. Um, I think there was a cost to that. I think the cost was, in many cases, there were competing demands, and there were competing kind of career paths and ambitions, in a sense, right, about what they wanted to do individually with the findings with the project. You know, some of our participants were very much in the project because they wanted to go on and do more work with these fishing communities on conservation, or the refugees were more interested in building their sense of community amongst the Rohingya community in Malaysia. So I think, you know, we never, this was funded by the British Academy, and I should give them credit. They never put pressure on us to kind of crank up the outputs. And whenever we had a discussion with them about changing some of the focus from an academic output to, you know, one of these policy interventions or this practical output, they were always very supportive. And so in that sense, kind of, I didn't ever feel the need that we were kind of having to make trade-offs
Trade-offs. Okay.
because there wasn't that pressure, which often is kind of what forces the trade-offs.
Okay, thank you so very much, Martin. There will be chance to ask oh there will be chance to ask further questions of you later on. So please don't run away. Just to keep to time, essentially, we're now going to move on to our second speaker, which is Professor Federica Angeli. I hope I'm pronouncing it correctly because
That's
my
a
entire
difficult
department.
one, Carisha. That's a difficult one. Thank you. Can you all hear me fine?
Yes. Do
Okay,
you have
brilliant.
slides that you want to share as
Yes,
well,
I
Federica?
do. Let
Okay,
me
you
just
should be
share
able
that.
to. Thank you very much.
Yes, can you see this?
It's coming up now. Yes, we can. And I'll just mute myself so you can get started.
Yes. Well, thank you very much. It was extremely interesting to hear Martin and his story and his case. And I can see to some extent some points of connection also with my story, which is not going to be a case study actually. It is more, I've been thinking a little bit about what to tell you today and how to sort of frame this talk. And I thought, perhaps I can share with you how over time I sort of engaged with policy and I sort of created a dialogue with policy in different ways and with different approaches. So I'm a chair in public management and strategy and deputy strategists and people at the School for Business and Society here at the University of York. And my focus of research is essentially looking at adaptive organizing around global equitable healthcare delivery and poverty alleviation. So essentially, over time, what I do is looking at how organizations and system of organizations, in a way, can mitigate or can contribute to reduce healthcare inequities and mitigate inequities related to poverty. So can tackle essentially poverty alleviation. And so in terms of engaging policy over time, essentially what I've done is to take a bit three different approaches. You could see as three different stages of building that policy dialogue or in a way create that discourse. One, I started a bit from observing and evaluating policy interventions and policy through research. So here the focus has been a little bit more on evaluating policy or policy intervention at different times and places. And the effort here has really been on provide a new perspective, a new recommendation to existing policies. So a bit from a different standpoint, a bit as a remote observer in a way. A different type of contribution has been create evidence together with policy. And in that sense, I will share with you some engagement, collaboration and opportunity that I had with OECD in a project, a reflection, an expert consultation that I've been involved in around collaborative approaches for critical health technology. And here, if you want, the effort has been to maximize impact of existing research by co-producing policy in a way. So co-producing, helping them to produce the guidelines based on also what was their input. So there was a sort of a bilateral collaboration in that sense. And the third stage that I've been involved with more recently is really co-producing research, a bit along the lines of what Martin was explaining. And here I've been quite involved with public decision makers and NHS senior leaders. And there has we really managed to co-produce from the very start a research project that was framed around their knowledge need, framed around their questions. And in fact, I do see also that tension, if you want, that trade-off that needs to be made. And it's beautiful when it's not perceived as a trade-off or a tension any longer, but there is always that element, that tension between theory and, if you want, practice, theory and policy. Now, in terms of the first aspect, so we tried here looking at, this is an example of evaluation of the National Rural Health Mission on health inequities in India. We have done this quite some time ago, and we tried to sort of develop a new lens, which is not entirely new, but we looked at this policy intervention with a complexity lens, a complexity-driven lens, looking at policies as complex interventions. So the National Rural Health Mission on Health Inequities in India has been implemented in 2007-2008, and is a very broad multi-strategy intervention that essentially has 4 pillars, as you can see here. So health system strengthening, maternal healthcare strategies, child healthcare strategies, and communitization, with the idea to change behaviors, improve sort of the status of women, so try and also improve health literacy, improve communication, having these women much more involved into understanding the importance of maternal care and the importance of, for example, antenatal checkups. You might know that maternal care is a long-standing, highly difficult to tackle problem worldwide. And to some extent, it is the reflection of differentials of income and socioeconomic inequities, both within and across countries. So the idea of this policy was to implement all these strategies in different ways. So each pillar is made by different strategies, with the idea to then improve maternal and child health outcomes and reduce inequalities in the country. So together with a PhD student of mine, Madhu Gupta, so unfortunately I didn't do myself the field work, we tried to evaluate this policy through a complex intervention lens. And you see, in fact, that this policy had, so here on the right side, on the very right column, you see the p-value, so the significance of difference along a number of indicators before and after the policy was implemented. You can see there has been a significant improvement, for example, on antenatal care uptake. However, much less has been achieved on the child health immunization. And overall, if you look at maternal mortality ratio, unfortunately, the difference is not significant. And maternal mortality ratio is typically considered as one of the chief indicators of maternal care. So why hasn't this worked? Now, the idea is you can't only and always evaluate the outcome of it. You need to undergo a process evaluation, and in order to carry out a process evaluation, you do need to interview, and you do need to get in-depth understanding into the perspective of how implementers have implemented the policy, how the receivers have perceived the policy, to what extent the implementation has been done in full or partially, what have been the barriers. So there is a whole process evaluation that needs to be done, or that we have done, or she has done rather, that links the pillars to the impact, all through the pathways and processes, output, outcomes, and then the impact, and hence the community-wide, the society-wide improvement. And in this sense, it's important to underline that complex intervention theory uses a CMO mechanism, so the context, mechanism, and interventions, meaning that the same mechanism might produce different outcomes in different contexts, or the same outcome might be achieved in different contexts with different mechanisms. So essentially, the concept of complex intervention, which you're probably aware of, but it is to understand what works for whom in what circumstances. And so this was, if you want, the first approach for me to policy evaluation, and to understand what is behind policy, and to understand sometimes the mismatch between, the logic model as it is set out in the mind of the policymakers and actually what happens on the ground. Another great opportunity, and we don't talk about COVID anymore, I know. Well, we heard about it before. It's like we don't talk about Bruno, we don't talk about COVID. But yes, another great opportunity was the COVID-19 pandemic to evaluate policy. And in this sense, I had a great fun with a long-standing friend of mine in looking at the differences of policy interventions to curb the epidemic initially. And here it's interesting to see also how COVID has become a wicked problem over time. So at the beginning, it was a clear-cut issue and matter of reducing the spread of the virus. But then over time, it became, a trade-off between different conflicting objectives. What about mental health of the youth? What about economic recession, economic growth? What about businesses? What about, so is it all worth it? And interestingly, we see that the very same problem across the world has been addressed in very different ways in different countries, between, for example, Italy and England, and also over time, so between the first and the second wave. And we ascribed these differences to a different ethical compass that was, underpinning policy decision making. So it's the differences were rooted in different social norms. So in Italy, being, especially in the first COVID wave, so Italy has generally been more restrictive than England, but especially in the first wave, there was much more attention to utility, so to, achieving that objective, and less on liberty and equity. So that led to a couple of publications, and also to further thinking about this aspect. We together with another colleague, we looked at the sense-making and learning challenges for policymakers during the COVID-19 pandemic. Policymakers, didn't see that coming, and also struggled to make sense of it whilst they were embedded in the pandemic. And we argue that one major problem that is ongoing is the lack of a complexity-driven mindset, the lack of complex reasoning, the lack of a mindset and a cognitive frame that is unable to appreciate non-linearity, feedback loops, path dependency. So you see the path dependency when in the differences of policy outcomes of interventions that have been set out to manage the pandemic over time, because it's, these are societies, they're never the same at different point in time. That was another, pushing a different lens or proposing a different lens and here we had the opportunity to do interviews with the Italian Technical Scientific Committee that was producing evidence to inform the Italian government during the pandemic. And they told us actually that to some extent they were making policy themselves, which is quite interesting, because then you remove entirely the filter of policy. And also we had the opportunity to present this finding to the Westminster Higher Education Forum in 2020. Now, instead, a different experience for me has been creating evidence together with, policymaker or a policy body. And this is the OECD example. So interestingly, at some point in 2016, I published this article in which we were looking at business model innovation for inclusive healthcare delivery. So essentially, and it's a bit close to what also Martin was talking about, we were looking at different cases that organizational cases that managed to to be picked up by the public and to be accepted by the public, to be socioculturally acceptable to very poor segment of society in resource-deprived settings, so in India. So these are, business model innovation. And what we have seen is that, value proposition, appropriation, and creation are typical aspects of any business model. But what we have seen, the real point of differentiation of these business models was the value discovery part. So there was a very strong engagement with patients and communities in these settings. And these business models were exactly tailored to what these communities felt and recognized as beneficial. They were not tailored according to what, the white man or the white woman or the person further removed thinks or thought they needed. And this was a very, very important point of differentiation present in all these cases. Now, interestingly, and that was the foundation of this gear model that you can see here. Now, interestingly, this study has been picked up by the OECD Science and Technology, and they asked me to reflect on how collaborative approach in an ecosystem can help promote not only health technology innovation, but also distribution, deployment, and uptake. And what are the challenges? So essentially, they asked me, can we move this framework from organization level of analysis to an ecosystem level of analysis, looking at how different actors in ecosystem, multiple stakeholders need to collaborate to make this work and to create new technologies and new services in the healthcare space that are able to really address the needs of poor communities and communities in need. So from an organization center to a more systemic view of business models. And I had the opportunity to sort of think myself about these ideas and to contribute these ideas through a couple of workshop and expert consultations organized by the OECD. And in fact, we came up into this model, which applies the same framework, but looks at how cross-sector partnerships at different stages and different aspects and realms of the business model can contribute to create this ecosystem and can contribute to really shape these new organizational models. And we highlighted the importance of a citizen-centric approach at every stage of technology design, commercialization, and distribution, and the key salience of co-creating this through the NGOs and the third sector. And this has been has led to the production of a policy paper by the OECD some time ago. Now, this discourse went on, and I was more and more interested in adopting what we call a socio-ecological model. And the socio-ecological model looks at, again, the importance of an ecosystem of actors and of appropriate incentive and financing mechanism and financing system. And in the socio-ecological model, we really see how everything is connected in a way. So citizens' behavior, individual behavior, and systemic outcomes are connected and are, influenced and shape factors at different levels of analysis. So family and community support, norms and value, organizational models, but also policies and the natural and built environment. They are all in connection, and it is this specific model that incorporates policy in the type of research that I do and that we do. So interestingly, we used this model, for example, recently to look at maternity care delivered to vulnerable pregnant women in England and worldwide. And here we combine an intersectional model with a socio-ecological model to explain, and this was quite an interesting case that I came across. I'm happy to, talk about this more, but I won't now because otherwise we're out of time. But this is a very interesting model that this group of midwives, and we're talking about 7-8 midwives in Leeds, they came up with an entirely new model to deliver maternity care to vulnerable women. And here we're talking about asylum seekers, refugees, homeless women, and so on. They put at the core the understanding of their vulnerability as a unique lived experience. And they really managed to create a model that delivers, that builds trusted relationship, for example, through home visitations. And in light of that, and they are able to come to a holistic understanding of their circumstances and to activate a network of partners, police, third sector, different charities, that is unique to each woman and is unique to the needs of each woman. And this is, has been possible through the experience that they've had and the type of lens that we use to look at that. We used also the this type of model also to, for example, consider and investigate mental health management in Indian slums more recently, but I won't go too much in depth. Now, the last point and the last sort of mini case that I wanted to share with you is about the most recent co-produced project together with practice and together with the NHS. And here, this little graph is for me to, be happy about the fact that maybe I got to the point in which I combine these three levels of analysis. So policy, organizational, but also incorporating the patient outcomes and individual level. Now, this specific project is called System Integration through Network Governance in Place-Based Partnership. Came to the fore and came to light really because of a conversation that I had back in June 2023 with the director of a place-based partnership. Now, place-based partnerships are a new organizational model underneath the new integrated care boards that came to were set up in 2022 as part of the deep reorganization of the NHS following the Health and Care Acts. Now, she was telling me, you know, we need to move from a competitive to a collaborative approach, but we don't know exactly how to do it. We have to completely reorganize the way we work. We don't know how to do it. And deliberately so. So each integrated care boards, and there are 42 in England, have been a bit left to their own devices, and probably to reflect the uniqueness of each region and the uniqueness of population needs in each region. However, they also struggle, and they don't know exactly how the collaboration is working, whether it's working, what are the challenges. So she asked me essentially to co-produce a research project. And this has been a really interesting experience for me, because we produced everything together, from the proposal to the research question to the interview protocols to the data collection. They've been extremely supportive in setting up interviews with the partners. And I've also just finished a 6-month secondment with the organization. I worked there 2 days a week, and it was funded by the ESRC IAA, so Impact Accelerator something. I always forget the second A. And we now also have a PhD project attached to that. And so it is ongoing. So I'm in the midst of this analysis. So unfortunately, I can't tell you much about the findings. But it's been really, really interesting because the place-based partnership is composed by councils, hospital trusts, third sector organization, hospices, schools. And it's brilliant to see how they all try to come together to reduce health inequities and to improve, health and social care in York. Now, this is my last takeaways about this specific project and generally. So it is important when, collaborating with practice and with policy, it's obviously very important to have clear objectives, but also objectives that are aimed at both theory and practice equally. So talking about the trade-off that we mentioned before. So ideally, they should be just completely integrated since the start. It's important to continuously monitor and the stakeholder commitment and alignment with aim and research questions, which is a point that is particularly relevant for example, in a dynamic and volatile environment such as the NHS. Think about scrapping NHS England, defunding, the ICBs. It all changes as we look at it. So it is always important to keep the pulse of what is prioritized by the people you're working with. And especially during my secondment, third point, I think it's important to absorb as much information as possible about the context from as many people as possible to really being able to contextualize, which is, again, really key in such a complex environment such as the NHS. So ultimately, relationship building and maintaining is key to anything we do with policy and practice. Well, thank you. I think I'll stop here.
Thank you so much, Federica. That was a lot of information. I think I'm still
Yes.
processing. But I do have some questions, but I'll throw it out to the everyone before I get started. Does anyone have any pressing questions? Oh, Katie's just telling us that she's leaving. Okay. So from my understanding of kind of what you've looked at or what you've gone through, you have an in-depth knowledge of like different policies. Now, as researchers, we like they could be written in language that we don't get. Like, how did you become comfortable in getting that in-depth knowledge and then in working with these partners who would have more knowledge than you in this area? Like, how did you manage that tension between wanting to have an impact in something that you might not know as much as the other people that you're working? Does that
I
make
think
sense?
That's a really, really good question. I think, well, on the one side, as I said in my last point, really talk to as many people as possible.
Okay.
Take on as many views as possible, because ultimately policies, yes, there is the policies that is written. There is the outcome that, is in the mind of the policymakers. There is the logic model that they have in mind, but then there is a whole part around how is this policy implemented? What is the experience of the people who are implementing actually the policy and living the policy on, in their day-to-day lives? So I think it is important to, it's a bit like, the elephant metaphor, if you want, one is touching the leg and feels like it's a snake. One is touch. So
I love that
wherever
picture.
you look
Yeah.
at it from, it's always going to have different shape, because it's highly value laden, both the policy formulation and the policy interpretation and the policy implementation. So I think it's important to talk as many people as possible, embrace the fact that it's always going to be a partial view in a way. So no one will ever hold the holy grail of how this policy needs to be implemented or understood, and have an interdisciplinary team that can be of help. So, for example, when I think about the evaluation of the National Rural Health Mission, obviously we had a team of my PhD student is a medical doctor. She's working in India. And so she has a lot of that contextual knowledge, which is very, very important. When I think about COVID, my co-author is a bioethicist and so works in yet a different space. So again, lots of different views from the practitioner side, but also from the academic team that you're working with.
I get that. That makes sense.
Mm.
So essentially, be okay learning things from the people that you're working with and
Oh,
recognize that they
absolutely.
also have a lot of knowledge. That makes
Oh,
sense.
absolutely. Yes.
The other thing I was struck by, Federica, is the fact that a lot of it seems very workload intensive for the organizations, for them to
Mm.
actually, especially if it's not their original culture. So if they're not like open to this participatory aspect of
Yeah.
things and this collaborative aspect of things, have you ever found yourself having to convince them in terms of kind of the, even though there's this intense kind of workload or perspective change that will be
Mm.
important in the long run, or were they always kind of fully on board?
They were fully on board, but I can tell you, for example, there is a slide, there is a slide that I didn't show.
Yeah.
But for example, there is, in every case that I came across from my studies around collaborations in this space, there is always a lot of work that goes into overcoming reluctance, learning how to speak the same language, learning how to deal with different logics of work. So, for example, that slide that I didn't talk about was about the the design of a maternal health device that was meant to detect, to diagnose early on high-risk pregnancies. And that was a collaboration between Philips, the multinational corporation, the charity attached to Philips, and the ICRC, so the International Red Cross Committee. And, most of the case was around, we all agree on the objective, but it is really, really difficult to align the ways of working and to align the different incentives within a collaboration, because each part has, just different interests and different ways to perceive success and evaluate performance, and also different timescales of working. So yes, it is very intensive, and that's a very good point, Carisha. And also from an organization point of view, having to do the co-production, that's a lot of work and that's a lot of research that goes into that. And not every organization has the opportunity to do that. So probably most of these that's why many of these organizations are grassroots. So they come from those very communities. So they already have embedded that knowledge. And even so, you always have to be careful about whose voices are you listening to. Can we be sure that the voices that we are tailing these services and products to are represent the needs of everyone, because there might be also some democratic issues and power dynamics there too. So yeah.
That makes complete sense. I do have other questions for you, so I will email you with those questions.
Yes,
We just
please do.
ensure that we keep to time. So we
Yes,
are
thank you
meant to
very
have a
much.
bit of a brief break. Thank you again so much, Federica.
Thank you.
We will have about a 3 minute break for people to kind of get up and stretch their legs. So we'll start back in exactly 3 minutes because I don't want to keep you guys over. And we'll start back with Nicholas. So we'll start back again. Oh, a minute has gone while I was speaking. So we'll start back at 1:08. All right, everyone, it's 8 past, so we're gonna jump back in there. So we're gonna start again with Nicholas Priest, a professor in SBS as well, and he's gonna talk to us about his area of specialty, which is homelessness. Okay, Nicholas, just get started. I'll mute myself as well.
Okay, well, thanks very much, Carissa, for the invite. And I was trying to think about the best way to do this, and it kind of turned into a bit of a broader discussion about where social science has got to around inequality and how we think about inequality. So we started off by mapping stuff. So we're the kind of first transition, the beginning of social science, the beginning of the understanding of poverty, the beginning of understanding of severe social problems like homelessness, was to move away from essentially kind of medieval ideas that whoever was experiencing any kind of social problem was the cause of that social problem. So that, if you were a member of what would have been called itinerant or landless or houseless poor people, it was your fault that you had come into that situation. You were either sinful or, and later on, if you weren't sinful, you were sick. And that was the explanation. There was something about your behavior or your characteristics that meant that you were the cause of the social problem. And the analysis kind of began and ended there. That was how society reacted, and there wasn't kind of much of an attempt. And then, so the late 19th century, you get the beginnings of social scientific inquiry, and that begins with people like Charles Booth, and then people like Stephen Rowntree in York, who start trying to map the nature of problems, to look for patterns in social problems. And this is the reason I'm talking about this, is it's the first step in trying to actually understand the work that I have focused my career on, which is housing inequality, housing exclusion, and homelessness. So poverty as it relates to where people live and how they live. And this is the first step. This is London in the 1880s. It's York at the turn of the last century, where you start mapping where people are living in situations of deprivation, inequality, which are very often linked to the built environments that they're living in. So it maps where the slums are, essentially. And that's the kind of first step. And then the next step is you start to get statistical data, and quite quickly you start to computerize that data. So you go from kind of mapping to starting to, it's not just, where are these populations? You're now starting to collect data on who these populations are. You're getting a lot of that data because you're starting to intervene around poverty. You're starting to develop systematic benefit systems, welfare systems, public health systems, all of which collect data. And governments start to have more and more data on people who are marginalized, disadvantaged, experiencing problems like homelessness. So the first attempts to systematically document who is homeless and who's experiencing it start in the 1960s in the UK. And both governments and social researchers, as they get access to these computers, they're a bit like a sort of toddler with a new toy. They're going around looking for things to analyze using this data because they've got this data. It's like a kind of 2-year-old with a toy hammer, and if you give a 2-year-old a toy hammer, they have to find things to hammer with it. It's that kind of logic. So everything starts to become, the terminology of things around it being social scientific is because you are scientific, because you've got data on problems like homelessness, which is being recorded, processed, documented, and analysed. And of course, the most recent iteration of all this is what's going to happen with data merging, machine learning, and AI. So in the coming years, you'll hear a lot about predictive analytics being used as one of the kind of analyses and ways of responding to homelessness. So it's all data, data, data. And it's all very remote. It's all statistical information. It's all things that are recorded about people. It's the analysis of records of data about people. It's not the analysis of people themselves. And quite frequently, it's either governments or academics that are deciding which data are important, which data should be collected, which data should be analysed. There's a beginning of realization which kind of starts with the emergence of qualitative social scientific research, which is there starts to be an understanding that if you just look at things statistically, you have gaps in your data. I mean, one of the ways in which you find that is you have statistical artifacts when you do analysis. I'll try and ask a question and you can't answer it with the data that you've got. So you look at ways to try and augment that. So you get the emergence of qualitative social science, which is looking at these things. And part of the logic is you're trying to get more of the understanding of what the nuance is in terms of, if you start talking to people, you can get a deeper understanding of what's going on. But even at this stage, even as we start to talk to people, we're still observing. So we're setting parameters about how we talk to people, which questions we ask. We use particular frameworks for doing that kind of analysis. And everything is still observational. Everything is looking at things on that basis. And what happened in my field, what happened in homelessness research, was everything kept going wrong in terms of policy and practice and analysis. So the story of homelessness from about the late 1970s onwards, when it starts to reappear as a social problem, is it just gets worse and worse. And each intervention that is developed, and this kind of echoes some of the stuff that Federica was saying, each intervention that was developed was ineffective. Each intervention was built using data analysis, using past practice, not talking to people. Then in the 1990s, one particular American, Sam Decembris in New York, had the remarkable brainwave of asking people what they needed and what they wanted. And that led to the thing I've spent the last 15 years doing a lot of research on, which is his idea of the housing first model, which it wasn't called co-production at that time. It was American. So they called it consumer choice in service delivery. So it was about building services that started to listen to people. Emphasis would be on starting to listen to people. There were still all kinds of controls and expectations. You weren't allowed to kind of build your own thing, but it was much more consultative than it used to be. And the key thing about that, and the thing that started to produce change in terms of homelessness research and analysis was that this service model that was talking to people was effective. It was much more effective, much more cost effective than the stuff that had been developed before, which hadn't been based on data, which was about talking to people. So co-production has emerged in homelessness research, and it came from the wrong place. It took other academics. It took academics talking to other academics saying, if you talk to people about what they want and how they think it should work, it means things that you build are more effective. But it didn't come from the ground up. It came from some academics telling other academics that if you talk to people, you got better answers than if you didn't talk to people. And you got more impactful research that you could transfer into policy and practice. Hardly a surprising result. We've known this a long time about health systems, social care systems, other kinds of public engagement, but you talk to people, you get better services if you listen to them about what they need, what they want, and how those services should be designed. But I think it was a real illustration of the level of systemic inequality in research and how research is organised, that with that idea of engaging with people with lived experience only emerged because academics decided it was an interesting thing and started to pursue the idea. There was no mechanism by which the people experiencing homelessness who were being researched could feed into that research. There was no way in which they could influence what the academics were doing from the ground up. It came initially from the top down, and I changed what I was doing, but I worked within these frameworks, and I was data driven, and I became more and more and more co-productive over time, driven by these things. So I'll finish off by just giving a kind of quick example. So the first time we used this kind of technique was when we did the analysis of the Finnish homelessness strategy, which is about 10 years ago now. And that was commissioned by the Finnish Ministry of Environment. And the Finnish Ministry of the Environment used standard government and academic practice and said, we want you to do this analysis. Which data do you want? And they were slightly surprised when we said, yeah, we'll have some data, but we mainly want to talk to people. We mainly want to talk to people about their lived experience on the ground, about what they think about the strategy, about what they think about the services that are being designed and provided. And we were finally starting to kind of realize what the starting point should be in terms of exploring systemic inequality and the experience of systemic inequality. I mean, we did some of it through translation, but because Finland has wonderful public education, quite a lot of the time we could just have those discussions in English with the people experiencing homelessness. And the most recent example of doing this is working with the Good Organisation, which is one of the community groups in York. We've been doing the same thing in relation to the city's homelessness strategy and trying to, again, use lived experience as being the foundation on which interventions are built. Finished off a little bit with the opportunities and challenges. When you really co-produce, you do get a better quality of social research. I'm a firm believer in that from having gone through the experience of doing it. You can't really put yourself in somebody else's shoes, and the kind of the core logic of co-production, which is nothing about us without us, is fundamentally important to understanding what the nature and the experience of inequality in problems like homelessness is. That you can't put yourself in that person's position. You have to give that person a voice if you're going to really understand what they're experiencing, if you're going to generate effective research on that, and if you're going to generate impactful work on that. It's challenging because with something like homelessness, with other kinds of social problems, you can empower people through research, and the government still just ignores whatever the research says. The research doesn't do anything about the baseline inequality. It's you're attacking the baseline of inequality, but the baseline is still there. There's still those challenges. Also, it's a hard sell for research funders. If you are really co-productive, it can be quite difficult to get stuff funded. I mean, I've had stuff turned down when we've tried to be co-productive with funders. And you can, on one level, you can understand why, but there are kind of contradictions around some of the things like UKRI and so on in terms of what they say compared to what they actually do, which is they say, you should involve people, you should be co-productive. But if you are co-productive, you're dealing with some uncertainties. You're saying to people, you're saying to funders, we're not sure exactly where this is going to go because we're co-producing it. So the way in which the research is going to be structured and conducted is going to be determined working alongside people with lived experience to do it. And the other thing is that you are relinquishing power, and that's quite difficult for big-headed professors to do, is to say, if this is going to be effective, I shouldn't be in charge of it, and I've got to facilitate situations in which other people are in charge, people with lived experience are in charge. I suppose that the other thing around this is there's a sort of if people talk about research with communities and engagement with communities, and there's a kind of assumption that communities are sort of lovely, fluffy, nurturing environments where everybody gets on with everybody else. But you are dealing still with human beings, and some of the experience around co-producing research is that they don't always get on with each other or agree with one another. So another dynamic in terms of the management of co-producing research is that sometimes you're trying to find where the point of connection is in voices that are actually not all in harmony with one another. There are disagreements about how to approach things. There are different ideas that people have, and you shouldn't assume and should never assume that if you're working on something with a population with lived experience, that population's all going to think the same way as one another. And then you have to think about how you're going to manage situations in which they don't. And I shall come to a stop there. Thanks very much.
Thank you so much, Nicholas. That was really quite interesting. I do have some questions for you, but I'm going to ask if anyone else has any questions first. Okay, so I'm going to just jump in. Okay, so essentially across the talks, what we're seeing is that policy impact isn't about getting words written on a government paper. It's about ensuring that whatever you are suggesting has an impact on the actual populations themselves. Um, is that the case in your work? Like, do you feel like that has to be the priority in terms of whatever policy might eventually come out for it to actually be an effective policy? The policy impact has to be seen in terms of the impact, not that it's having in terms of getting your name on a paper, but in terms of the impact it's actually having on the population itself.
Yeah, I mean, I think one of the problems we've had in higher education is around what impact actually means, and the
Mm-hmm.
kind of confusion that if you get a big splash in the Guardian, that means that there's impact, which is not the same thing as actually promoting policy change. But in terms of co-produced research, it means trying to advocate and trying to get ideas across about how people who are, I mean, in the case of something like homelessness, who are almost completely politically marginalized. So, I mean, they do not have the capacity to self-organize, to present their case available to them. I mean, it's very different. I mean, if you put it in terms of sort of housing experience, a rich upper middle class suburb can organize itself into a residents association and cause all kinds of problems. It can stop a local authority, or it can at least cause huge problems if a local authority decided to, or a developer decided to build a lot of affordable housing or social housing in which homeless people might live. There's no capacity in a population that are just have no resource available to them in order to be able to do that. So what you're trying to do, if the co-productive research works properly, is there's a political dimension to it, because you're trying to give them a voice and empower them, and then you have to be very careful that you're representing that voice in the right way, so that it's not just that they're helping you design the questions, do analysis and so on. They're agreeing with you about how the results are presented, and how those results are articulated.
Okay, that makes sense. That kind of sheds light on terms of actually being able to present something that will be effective if it is integrated into policy. But we still see within the governments that there's this preference for large-scale quantitative data to inform actual policy. Is there any way that we can add value to that quantitative data that does not involve co-production?
I mean, it's difficult. I mean, something I've not ever seen is around my own field is somebody trying to kind of revamp the nature of statistical data so that it's actually a sort of co-produced measure. It tends to be qualitative work, and
Okay.
it would be an interesting idea about whether or not and to what degree you could capture opinion. Um, you could do it. I mean, there's mechanisms, we've long had the mechanisms to do opinion polls and things like that, but I don't think that's something that's been particularly
Okay.
attempted. Um, it's also about the complexity of experience. There are multiple ways in which problems like homelessness are experienced, multiple trajectories through it. So there's stuff about that. There's a basic methodological challenge, which is for something like homelessness, you don't know what your sample universe looks like because you don't have clear data on it. It's hard to enumerate the problem that you're
Okay.
talking about. You know that it's there. So if you sample 1,000 homeless people, you don't have the same degree of confidence that you would using standardized techniques to sample 1,100 citizens and ask them which way they would want to vote. So there would be methodological challenges. But yeah, I mean, it's also about how you what kind of data is available. I mean, we've some people have started to explore self-representation of the experience of homelessness on social media, because those technologies have become quite accessible, and whether or not there are ways to systematically explore that. But yeah, I mean, it's hard. I mean, statistics aren't science, but governments tend to think they are. I mean, they don't really, a lot of ministers wouldn't understand necessarily what the difference between association and causation is, for example. So that kind of challenge does exist, yeah.
Thank you so much, Nicholas. Federica has a question, I think, for you. You're on mute, Federica.
Sorry, it's more of a comment on what Nicholas was saying, because of course the methodological constraints are important and an important barrier. I just wanted to flag two methodologies that I've been using more and more recently, which I think sort of combined lived experiences and the need for quantitative analysis with a sort of statistical power. One is the discrete choice experiment. We use that, for example, in analyzing product preferences for menstrual health management products in slums. And it's very easy to administer because essentially respondents, so in that case, slum dwellers, are required to choose between 8 questions, choose between different profiles of different products. And that has quite a lot of power because essentially it's each choice is an observation in that sense. So if you have 100, then you would have, 800 observation kind of a thing. It's easy to administer because it's simple. And it did, reveal quite some interesting findings, for example, because then you've got a statistical analysis. And for example, from that project, it came out that slum dwellers do value the environmental impact above everything else of products that they were presented with. And the second method is qualitative comparative analysis, which is quite interesting because it sort of it is based on a configurational view of causalities. There's not like one variable that varies and the outcome, but it's more, configurations of condition and circumstances that lead to a specific outcomes, and they can be equifinal pathway to the same outcome. So I think those are quite easy to use, and qualitative comparative analysis works well also with a small number of cases. Just wanted to flag that.
Thank you so very much, Federica. I've taken note of those two things. Okay, so in light of a time, we're just gonna finish off really briefly, really quickly with so the EDI Research Centre tends to always have a project associated with each of its themes. And so within this, I'm not sure. Which screen are you seeing? Sorry, I have lost myself. Share screen. Screen 3. Are you seeing the slides? Ah, okay. So you are seeing the slides. Okay. So essentially, within this theme, what we're trying to do is we're trying to figure out how to support policy within the University of York. And so we did a kind of deep dive into a range of policies that exist. And one of the policies that exists is the the public sector equality duty under the Equality Act in 2010. And what it requires is that the university prioritizes and fostering good relationships between members of staff as well as members of as well as registered students. It also includes visitors and everybody who comes on campus, between those who have protected characteristics and those who do not. And so what we're going to do together with a couple other stakeholders who are also in this meeting is to develop a cultural awareness program. And so it essentially is going to focus on educating staff and students on the nuances of lived experience of students and staff from underrepresented backgrounds. As a first port of call, we're going to focus on staff to staff interactions, but those staff will also include PhD students. So that's why we have these staff and student nuances here. Essentially, what we're going to try to do is to develop scenarios to first identify gaps. And we also want to understand individuals' confidence in dealing with these different scenarios. So, for instance, one of the things that we still get as Black women is that people call us aggressive when we tell them no. And there's a deep colonial history to the use of that term in terms of Black women being chosen to take care of white and the white housemaster's kids. And so we were meant to be, of all the slaves, the most docile. So that when I tell someone no, that's why they're taken aback, because I'm not allowed to tell them no because of that caricature of what a Black woman is meant to be in relation to a white person's needs. But also it's other things such as specific cultures not being able or willing or even having the capacity to consider having extensions for certain things, such as East Asian cultures, because the capacity to ask for an extension means that you're a failure much deeper than just a failure in terms of your work, but that has personal implications as well. And so those are the type of things that we want to see. Do people know? Do they understand these in-depth lived experience nuances? And so is that lack of knowledge then leading to us not being able to accomplish what we need to accomplish in relation to policy? So then we're going to have maybe some staff and student focus groups and co-creation workshops. It is a quite tight deadline because we have a financial deadline, but we're also looking into getting additional funding. So we've started talking to, for instance, the University of St. Andrews to see if they want to come on board, and they do have funding pots that starts in the summer. We have a steering committee so far with Simon Quinn, Liz Wance Murray, Linda Cofarino, who's in this meeting here as well, myself and Sylvia, who's in the meeting as well, and Hannah Gray from the head from public involvement and participatory research. As steering committee members, we're just going to ideally ensure that the project runs the plan, but also we having and representing the diverse opinions as much as possible. And so what we want to get is that we want to ensure that it reflects what is the reality of the University of York, because as we see, it has to be kind of co-produced from the scratch in order to have that impact on policy that what we needed to have. And so we're calling for advisory group members. So it can be that you have research in an area of an underrepresented or protected characteristic, or that you have a lived experience in this area. And so essentially, there's a sign up form here, and we will also be sending out kind of the recording, etc., for the session today. The sign up form will be within that email as well. And essentially, it's about kind of guiding us with the development of the different stages that we're proposing, using your research and knowledge as well as your lived experience. It's not a huge time commitment, around 1 hour a week, because we will also be hiring what we're calling student inclusivity influencers, which we're hoping to be PhD students who are kind of helping us in terms of the getting the research kind of organized and running as it should. So we will be supported by them. And so essentially it's just to give us that guidance and to help us to ensure that whatever we create has that impact or that capacity to support the policy. We have started talks with HR and with the larger EDI team within the university to see kind of what will happen with the final output. But we've also started talks with, for instance, other universities, so the University of Hull, the University of St. Andrews, Sheffield University, to ensure that it's something that does not only reflect the University of York, but also the other universities, because they're also kind of under the requirements of that Equality Act. And so that is where I will end off today. I recognize that we went 6 minutes over time, but we did start 5 minutes late. So essentially, that is all we have planned today. If you guys want to stick around, or if you have any remaining questions for these speakers, then please do. But also, I'm aware that a lot of people have other things to do, so you guys are free to leave. And thank you so much for coming.